Back, everyone. It's really nice to have you with us. And as we get started in the role play part of our presentation, I wanted to just take a moment as we're doing introductions for Dr. Joanne Jung and Jennifer Leland to share this image, which represents the field of flowers. I'd like to give my colleague, Joanne Jung, who's been instrumental in facilitating and coordinating this training. I want to heartily acknowledge all of the tremendous effort she's put in behind the scenes. Dr. Jung is an associate clinical professor of pediatrics at the University of California, San Francisco. She directs the Resiliency Clinic at UCSF Benioff Children's Hospital, Oakland, which supports mindful and attachment-based parenting. She is also the Senior Associate Director for the Child and Adolescent Psychiatry Portal and helps with many educational and other events for the program. And with that, want to also acknowledge that we're so excited to have Jennifer Leland, marriage and family therapist, who is the director of the Trauma Transformed at the East Bay Agency for Children. She is a licensed marriage and family therapist with an extensive background in community mental health programs, including work as a residential counselor, street outreach worker for sexually exploited minors, case manager, home-based family therapist, clinical supervisor, and program manager. Thank you so much. I can't wait for this.
Thank you so much, Petra, for that great introduction. And we are going to do a role play today. Jen Leland will be playing the part of the parent of a patient. And I'm going to be playing the part of the pediatrician. And I'm going to quickly share what the pearl screening might look like. So this is, for those of you who haven't seen a pearls, this is kind of what the survey looks like. And here I am as a clinician. I'm coming in and I see the score of 7, if you can see that at the bottom of the page. And this is in the middle of a well child visit for a 6-year-old boy named Lucas, and he is bouncing around between multiple PCPs, so I actually don't know him. This is my first time meeting him and his family. And with that, we are going to begin.
Yay.
We are actually in the middle, and in the middle of the well child visit. Looks like Lucas is growing well, and we've got the immunizations ordered up. But before we move on to those, I wanted to thank you for filling out the Pearl survey. Thanks so much for trusting us enough to share this information. I wanted to take a little time to go over the survey with you and explain why we ask these questions and how it helps us to make sure that Lucas is growing in as healthy a way as possible. I'm wondering, maybe Lucas can color with our medical assistant outside for a moment while we talk. Is that okay?
Oh yeah, totally. Lucas, it looks like they got some good colors that we don't have at home. Mommy will be back in a minute.
Thanks, Lucas.
Yeah, I was, thank you. I was wondering when you were going to bring that up. I mean, I get all these surveys, we fill them out all the time and sometimes never hear back about what is this for? Like, are you doing some sort of study?
Great question. No, we're not doing a study. And sorry if we're not always great about following up with the surveys that we give to you. For this particular survey, we're asking these questions because science tells us that stressful experiences, especially in childhood, can really affect our health in some important ways. And these kinds of experiences are also common. But with the right supports, kids can do really well and remain healthy despite these hard experiences.
Okay, what do you mean affect his health? Is there something wrong with Lucas?
Being exposed to a lot of distressing events like Lucas has doesn't mean that there's anything wrong with him. But I do want to explore with you if there could be any concerns, because we know that stress can affect health and sometimes it can show up as challenging behavior. Have you noticed anything in Lucas health-wise or behavior-wise?
Yeah, well, Lucas, he's been having some trouble sleeping at night sometimes. I try to get him in bed by 8. Doesn't always work. He keeps jumping out of bed. He really wants me to stay with him like all the time. I've started sitting behind his bed, beside him on bed until he falls asleep so he can get some sleep, you know? Sometimes he'll wake up in the middle of the night and try to come into my bed. And sometimes I worry because it looks like he's been having some bad dreams or some nightmares.
Wow. Well, given the stressful experiences that Lucas has had, it actually kind of makes sense that his body is having a hard time relaxing enough to go to sleep. When a child has had some scary experiences, the body is actually preparing to defend itself from threat. And that can include staying alert and not wanting to separate from trusted adults, like him wanting to stay with you, and also just having trouble settling down enough to go to sleep. As we both know, we all need sleep to stay healthy. So what have you tried so far with Lucas to help him?
Everything. I tried a nightlight. He gets a nighttime bath. I read him bedtime stories. I kiss him goodnight all over. I tried giving him stickers on nights that he stays in his own bed and not in mommy's bed. I took the iPad out of his room. What else? What else can I do?
Sounds like you're doing a lot already, and a lot of the things that we normally recommend in these kinds of situations, like that regular relaxing bedtime routine and taking screens out of the room. It's fantastic. Sounds like you're also trying to stick to a regular bedtime, which also really helps. One other thought is that lots of active play can actually help kids too with sleep. It's not only good for their bodies and just like every way, it's also great for sleep. So it might be a good idea if you haven't had a chance yet, make sure he gets lots of exercise.
Yeah. Lucas runs around the apartment, the house all the time. He's like running around at recess, at school all the time. But yeah, I mean, he loves playing at the school playground. It's been hard with the air lately. But now that it's cleared up, maybe we can, yeah, I mean, it's a good reminder to spend a little bit more time at the playground on weekends.
That sounds great. And when he's done being active, there are some other things that might help his body to relax whenever he seems tensed up, like going to bed or after a nightmare. Have you ever tried belly breathing with him?
Like breathe? No. I mean, we breathe.
Yeah, that's true. That's the beauty of it is that we all breathe all the time. But there's a special way of deep breathing. It just takes less than a minute. Like put one hand on your chest, one hand on your belly. Would you like to give it a try now?
Sure. Yeah.
What we do is we kind of breathe in slowly, say for a count of 3, hold it for 2. And we breathe out through our mouth for a count of 5, almost like you're breathing through a straw. Just try doing this like several times in a row. Just feel the air going in and out of your body. Just breathing and focusing on your breath this way, it can help your body to relax and your heart to slow down.
Yeah, that's good for mommies too. I feel more relaxed.
And it's good for pediatricians too, obviously.
I could try that with Lucas. Yeah.
That's great. Yeah, this is a great thing for all of us to be doing together, for adults as kids. Any questions about what we've talked about so far, or any other concerns that have come up for you?
Well, yeah, I mean, you mentioned something about stress maybe affecting behavior. So I know that Lucas's teachers have been calling, they've been emailing me quite a bit about some of the stuff they're noticing that he does in class. You know, they're worried that he's not paying attention that well, to the point that he's having some problems maybe keeping up in some of his classes. They've also said that at times he can just kind of explode, like for no reason. He starts crying, yelling, screaming, mostly when he doesn't get his way.
Yeah, that sounds concerning. Are you noticing anything like this at home?
Mm, Yeah, I mean, it does happen all the time at home. He used to be able, he used to be able to hold it more together at school, like he was better at school. So I'm worried, I'm not sure why he's having these more meltdowns now.
Yeah. Sometimes when kids are acting this way, it means they're dealing with something really stressful right now. And for any kid with a significant behavior change, I'd like to ask about safety.
Mhm.
Have any concerns for Lucas's safety at all? And are there any scary or upsetting things that he's either experiencing or maybe witnessing or seeing?
Um, I don't know. I mean, right now, I can't think of anything right now. Um, he's definitely seen some crazy stuff in the past. But I really don't think anything like that is happening right now.
First of all, I'm really sorry to hear that Lucas has experienced stuff like this in the past. But I'm really glad that he's safe now. It speaks to a lot of hard work that you've been doing, supporting him through all of this and bringing him to a better place. So kudos to you. But given that he's still suffering some of the after effects like nightmares and problems with sleep and some of these meltdowns that you've been describing, I'm wondering if it's okay with you if we could explore some more resources that might be helpful, like with sleep and with some of these big feelings. I think that his behavior might be telling us that whatever worries are on his mind, it might be feeling too much for him to handle by himself. He could probably use some more help. I do know some really caring counselors that are specially trained in helping kids who have experienced stuff like this. Would you be interested in a referral?
Um, I don't know. Counselors, isn't that just for people who are mentally ill? I don't think Lucas is, I don't know.
Yeah, no, I totally get that. There are images around mental health like this, but counseling isn't just for people that we think of as mentally ill. It's for anyone who's starting to have some difficulties in their day-to-day life because of how they're feeling or because of their behavior, especially in the case of kids. Um, and there are lots of different kinds of counseling, especially for children, that we could explore and see if these sounds like it might be a good fit for Lucas. For example, there's play therapy. We don't think about therapy as involving play and toys, but there is play therapy where kids learn how to cope with and express their feelings in playful ways. So it feels safer for them. There's also family counseling that would actually be working with you and Lucas together so you can try out different strategies. So you'd be learning lots of different strategies at home to try to move these big feelings through his body so that he can get some rest and hopefully you can too. And they're also helpful with things like home routines and other tools that help kids to feel safer and calmer in their bodies.
Okay. Yeah, I can think about that. He might like the play therapy. I might need some more time to think it over and talk to him too. I mean, if he gets into trouble less at school, if he sleeps better, right? It could be worth a try. Are there things I can be doing at home for him, when he starts having trouble?
Like you're doing a lot of great stuff already, especially around the sleep. We can always try that deep breathing that we just talked about, and those extra sessions in the playground that you've been talking about. But what strikes me is that most of all is that Lucas might be having trouble feeling safe, even though he is actually safe right now, because
Mhm.
he isn't feeling that way. And,
Mhm.
so even if he can't tell you exactly what's happening, it's possible that these early experiences, these crazy early experiences that he had might have wired him and wired his body to kind of go on high alert fast. So a kid who's experienced something like that might see threat in situations that don't seem threatening to any of the rest of us, just because their brain is been trained to recognize threat faster. Does that make sense?
Yeah, that makes sense. That makes some sense. I mean, there's no tigers in our home, right? But sometimes there's noise to make me think there is. Yeah, I mean, I want to do everything I can to help his body relax. He is safe. Yeah.
And that's great. And clearly he trusts you a lot, and that's why he's turning to you at that time when he has those nightmares, and he's really attached to you. And this is going to be the thing that really helps him to get through this, is that close connection that he has with you. And it sounds like you're doing a lot of this stuff already too, but I've also got this handout that that might be helpful for you to look over. It's a couple things that parents can do that can help children to feel safe in their bodies. You know, things like hugs and play, like reassuring words and predictable routines. It's a lot. So I would say, don't worry about doing all of this, especially not all at once. Just look it over and see if there's something that seems like it might be good now to try, and that might fit you and that might fit Lucas, and see how it works out for you. But I would like to schedule another time to continue this really important conversation, and figure out what we can do together next. And we're in this together, and you know, I know good things will be happening.
Thank you. Yeah, I can do that. Thank you. Yeah.
So, role play over. And I wanted to take the few minutes that we have left just to share a couple of clinical pearls, both from the clinician point of view, which I'll be sharing, and also from the parent, family, patient point of view, which Jen Leland will be sharing. And I'm going to quickly, again, share the slides. So you see on these boxes on the right, these are things, they didn't necessarily come up today, but when behavior concerns, these are often like little mantras that I go to and talk about with parents all the time. And one that I find like really helps a lot is this idea of undivided attention and attunement, and just really being present, even if it's just for a few minutes every day. It can make a real difference in the lives of kids. But as I've been doing this work, I've also found that all these things I'm telling parents to do with their children, I need to be doing that in the exam room with parents. And more than anything that we kind of learn by like reading or hearing or through like didactics like this, I think emotional safety is something that we have to experience in order to share. And there are little ways in which we can build those moments of emotional safety in the exam room. And one of the phrases in my mind that I just think of over and over again is just non-judgmental empathy. Just remember, non-judgmental empathy, and that often just helps to guide the conversation right and ground it in a little way. Another thing that I heard that was tremendously helpful for me is move away from fixing people towards understanding people. And that took a huge burden off of me. Like, I don't have to go fix all these problems. My goal here is to try and listen and understand. And that can often help people to come to a place where they can start coming up with solutions of their own and get a clear understanding of what's happening in their own lives in a way that's tremendously helpful to help them to take a good first step. And with that, I want to hand it over to Jen Leland.
Mm-hmm. Yeah, hello everyone. Good to be here, honored to be here with all of you. So I wanted to talk about a little bit what came up from the caregiver perspective. And this is really just reiterating what Dana Long and Ken Epstein and Santoy Trotter have already expressed. That remembering that ACEs happen in a context and often a relational context, and so does healing. And that these screenings also happen in a relational context and can be both tender and transformative. So again, some tools I'll go over as well as an offering, and that you maybe saw in the role play as well. That, sometimes we have to think about that we are being screened too. They may not have a Pearl screening for us yet. But as soon as they call up to make the appointment, to sit in the waiting room, to watch what they're most folks are very attentive to what we are doing as providers. And that like was stated, it's not so much about fixing or even building trust It's just more about building our own trustworthiness. And so one of the practices that I recommend is that we do regular journey mapping from the patient experience through the screening. So that as you set up these protocols and workflows, that you take time, maybe schedule it in once every 3 months to see what it's like from the patient perspective. And then something that was done really well in our role play was attunement and authenticity. And so this goes back to what was stated before around connection, right? That lots can come up during these conversations, and that the tendency, at least for myself, even as a mental health provider, can be to sort of drive through the form, drive through the workflow. And that, again, so important to be grounded and to be present, because our presence is often the biggest medicine we can offer in that moment. That listening, that attunement, and that authenticity that we can bring. So we can hold our expertise, but also hold it with humanity, and that both are important. And then also creating a setting where patients feel comfortable exploring options for care while retaining or gaining a sense of control and agency in their own care. So there were many moments during that role play where I, as the caregiver, maybe came with confusion, or I came with a little bit of resistance or discomfort. And what made me feel grounded, what made me feel relaxed in the moment, and what made me trust her more in the moment was that she wasn't just handing me referrals and saying, this is what I think you need. It was a presence of exploring options and giving me some information and demystifying some of the services that we prescribe, refer for our families and caregivers, and giving me options. So there's 2 tools that we talk a lot about in our trauma-informed systems training. One is voice and choice. There are so many ways to do this. You all do this with informed consent, right? Voice and choice. So giving me the option for therapy, recommending the therapy referral, but also saying, here are some different types of therapy, and giving me the opportunity to really engage and have some agency in thinking about which type of therapy might be best for Lucas and I as the caregiver. There's a great acronym, very quick and easy to remember, ARC. Ask, respond, clarify, and confirm. And again, this goes back to cohesion, right? Ken and Santoy talked about moving from chaos to cohesion. Sometimes in the moment, these little acronyms can help me just remember how to extend voice and choice. And so again, asking, is there anything you want me to clarify? Is there anything we went over that you think would either work or may not work? Do you have questions about what we went over? And then responding to those questions. And then again, clarifying, did what I say make sense? Do you have any thoughts about what I said? And then confirming the plan, again, like repeating the plan. Again, just communication strategies, quick, that can offer voice and choice, and that can also offer quick ways to honor the movement that is often necessary in these tender conversations from chaos to cohesion. And I will just end with this quote that I've been carrying lately that again speaks to, I often also have the urge to fix, right? I also often fall into that trap. And that these conversations are transformative, and sometimes we won't see the fruit that is bared. And that the day you plant the seeds is not the day you enjoy the fruit. So this is again about right sizing, about being present and relational and planting seeds. So thank you, everyone. I'm going to stop there and see if we have questions or anything in the chat.
That was wonderful. Thank you for your authenticity and tenderness in those moments. That was really lovely to witness. We have one question that came through that is asking, how long would this take in primary care?
That's a great question, and we know that we're under time constraints. But we timed this, and I don't know what it was today. The conversation came out at 15 minutes, that conversation we had. Now, we were kind of supposedly at the tail end of a well-child care visit, and so this kind of is the equivalent of that doorknob question almost, except I kind of knew that I was going to be asking this, and so I probably left a few minutes at the end, just to kind of do the physical exam, all of that, but to leave a little bit of time. But this took 15 minutes, that conversation.
And I see that Dana Long put in, and that's what follow-up is for. Yeah.
This is very true. And that's also part of what was kind of modeled at the end, is that you're not going to do this all in one visit, not by any means. Introduce the topic, get the conversation started, and then continue the conversation later.
And kind of reflective questions from Dana Long include, for all of us, what has stood out during this role play? What are you already doing? What did you learn? What will you do differently, if anything? And if that reflection prompts more questions for you, we welcome those in the few minutes that we have remaining.
Wonderful. Thank you so much. Jen Leland, I really enjoyed doing this role play with you and planning this together. And I learned a lot through the process as well. And I hope everyone else here on this call learned a lot as well. If there are there any further questions, Petra, that we need to address right now, or can we move on?
Yeah, and follow up to the earlier question, when do you schedule a follow-up visit if something comes up?
That's all of our own clinical gestalt, like how urgent this feels to you. I like to do it fairly quickly before the memory of this fades. And a lot of this, of course, depends on practice considerations, like how impacted your schedule is. But I would look for something as soon as possible within family schedule and within my schedule.
Yeah, and I'll just end again, just reinforcing partnership, that this is partnership, that we're doing things with people, not for them or to them. And that, I don't know if folks notice, but as a parent, I was feeling, gosh, I've been doing all of these things, and is she going to give me a handout that tells me more things to do? So again, really that tonality of partnership, like we are in this together, and her saying at the end of the role play, like, you don't have to do all of these things. It's almost like a parallel process between provider and patient, right? But again, just really reinforcing that we are with you, that this is a partnership, and just thanking everyone for being on this Zoom today. Thanking my partner for the role play and the guidance and the work that everyone's doing in these tender and transformational areas every day. Thank you.
I just wanted to chime in really quickly, because many of us who are primary care physicians and are doing standardized screening are doing a hybrid model of in-person and telehealth visits. And so we are doing ACEs screening during well checks in person, but telehealth is actually a wonderful platform to do the follow-up. What I felt so deeply during the role play, first of all, it was beautiful, was just the connection that the two of you had. And I often find that when we're having hard conversations, even though it seems counterintuitive, doing them over Zoom is actually a great space to create intimacy, as opposed to doing it in clinic where we have to be 6 feet apart with our masks and our face shields on. And so we all need to increase the number of visits that we see, which is just a mandate of the economics of primary care at the time. And these really tough conversations, it's important to be able to get close and to look somebody in the eye. And so telehealth is a great way to do the follow-ups. And I tend to schedule them maybe the following week and as often as we need, until we feel as if there is a therapeutic alliance and that we have a treatment plan that is working.
And with that, thank you so much. Dr. Wong. And with that, I'd like to thank Jen Leland again, and we'll be moving on to our next presentation.